we have Lung Cancer Day on the 1st of August. This is basically to bring in awareness about lung cancer, the possibilities and the impossibilities of lung cancer, early diagnosis, treatment and the prognosis of lung cancer. As you know, lung cancer happens to be the biggest killer of men and women in this world from cancer. Unfortunately, those numbers have not dramatically reduced in the long run of oncological progress, but in the recent times, we have got great progress happening in the form of immunotherapies, targeted therapies and personalized medicine. Yes, lung cancer is treatable and curable in a big majority if they are detected early. But very unfortunately, unlike other malignancies like cervical cancer and breast cancer, which are much easier to diagnose in terms of diagnosis, lung cancer is a little difficult to diagnose. The reason was we didn't have a very good method which was safe enough to be offered to a lot of people for screening and early diagnosis. But now we have low-dose CT scan, which is pretty safe in the high-risk populations, and it can catch lung cancers very early. Even it can catch precancerous lesions, which can be biopsied, confirmed, treated, and then cured. Early lung cancers are treated with surgery. Of course, the surgery has become very advanced in the recent times. We have moved from open surgeries to minimally invasive laparoscopic VATS surgeries. So these surgeries reduce the morbidity and mortality of the surgery and improve the overall outcomes. So apart from the surgery, radiation techniques have become a lot better. The side effects of radiation therapy have come down dramatically. Outcomes have become pretty improved. So this has been a long-standing thing that has been happening over a prolonged period of time. In the recent times, the chemotherapies have got better. We have got multiple generations of chemotherapies, and more importantly, lung cancer, unlike other cancers, is started getting personalized. So the doctors take a biopsy, do molecular testing on your tissue, identify the molecular signature that is there in this particular cancer of that particular patient. So it is literally like a personalization. So based on the personalized signature of the cancer, the doctors will decide about the chemotherapies, the targeted therapies and immunotherapies that are available. And they do a mix and match and give you the best possible combination, which is useful in terms of curing the patient or keeping the disease under control for the longest period of time, and most importantly, reducing the side effects of treatment. So now, what was an impossible disease to treat has become possible to treat, possible to cure, and more importantly, possible to kind of keep under control for a very long time. Even in those patients who have got a very advanced cancer, which is incurable with surgery or with radiation therapy, they can be kept under control with these personalized medications for a very long period of time. So where we used to talk about survivals to the tune of 4 months and 6 months, now we talk about 3-year survivals, 5-year survivals. We are seeing patients who are surviving this cancer, this scourge called lung cancer, for several years together, in spite of them coming in advanced stages. So this, I would suggest all people at high risk of lung cancers, namely people who are smokers for more than 15 years of duration, and people who have quit smoking in spite of quitting smoking. If they have not quit more than 15 years back, they should consider themselves as high risk patients. Those are the people we advocate them to go for low dose CT screening. We do not advocate everybody to go through screening, but this high risk population should go through that one. And very unfortunately, we are seeing a large increase in the cancers, lung cancer incidence in women. Unfortunately, there is a high rising number of smokers among women. Apart from having a lot of systemic side effects, lung cancer is also rising in them. I would advocate people not to go for smoking. If they can, they should quit smoking at the earliest possible opportunity. We are here to help them. We, the physicians, the psychiatrists, everybody will pitch in and then help them in getting rid of the habit. And apart from the quitting of smoking habit, there is small hope in the form of screening low-dose CT scans. Please make use of that one on this lung cancer day and get healthier. Thank you.
Why is it so important to know about lung cancer? The thing is, in spite of so much of advancements in the testing modalities, molecular technologies and treatment modalities, even then lung cancer has been a difficult cancer to treat. So that is why it is important to know what are the symptoms, what are the risk factors, and if there are any screening modalities. So coming to the risk factors first. Smoking. Smoking is the single most important risk factor which causes lung cancer. So apart from smoking, recently what other risk factors have been gaining importance are, one is air pollution. This air pollution can be multifactorial. It can be regular industrial fumes, or it can be any wildlife fire or any unintentional burning what we do. And India, another thing what we see commonly is cooking flames. This is because of burning wood or coal for using for cooking, which is being practiced in rural India. This is also an important risk factor for lung cancer. Apart from this, people working in asbestos industries are also at an increased risk of lung cancer. So these industries usually include shipbuilding industries and automobile brake making industries, such kind of industries. So these people have to be extra careful and they have to use some kind of a preventive mask to reduce the pollution. Coming to, is there any way of detecting lung cancer early? That is a screening modality. Not all patients need screening modality. There is a certain category of people who are at high risk of developing lung cancer. So these people will benefit by screening. So who are these people? These are the people who smoke. So smoking people are at 20 times higher risk of developing lung cancer. So people aged 55 years and above and who have a smoking history of more than 35 years, these people need to undergo a low dose CT scan every year to see if they have any lung nodules or not. So now coming to what are the symptoms of lung cancer. So there are multiple symptoms, but commonly with which patient presents is with a cough which can also have phlegm in it or sometimes even blood. Sometimes if the cancer has grown big in size, patient may also come with a complaint of chest pain and other complaint like shortness of breath and then unintentional weight loss. So these are the regular symptoms. But if the cancer is more advanced and is spread to elsewhere in the body, they can have any kind of symptoms. So especially people with risk factors or who are being exposed to some kind of pollution and who have these common symptoms, they have to be more vigilant and they have to visit their oncologist to just confirm whether it's lung cancer or not. So on this particular day, what I would like to advise is, it is always better to have a healthy lifestyle.
Today we would like to know some facts about lung cancer and lung cancer awareness. Lung cancer commonly affects smokers, second-hand smokers and people who are exposed to radon gas. Important way of saving lives is quit smoking today. You can take help of your psychiatrist or you can talk to oncologists regarding the way you can quit your smoking.
As we all know, lung cancer is one of the most common cancers worldwide, and lung cancer is the most common cause of cancer-related deaths in both men and women. So the best way to prevent lung cancer is to say no to smoking in any form, cigarettes, BDs, or even passive smoking. And also people who are smoking have to stop smoking immediately.
So by raising the awareness about lung cancer, basically we should actually put in concrete measures to make sure that the dependence on smoking comes down, the incidence of smoking comes down, and also green measures should be taken to reduce the air pollution, because this will definitely have impact in reducing the incidence of lung cancer, and it will also help in saving precious lives. Now, one good thing about lung cancer is that if detected in early stages, it can be curable.
We can diagnose it early by doing screening with low-dose CT, especially 50 to 80 years of age with more than 30 years back history of smoking.
Lung cancer is one of the most commonest cancer, claiming thousands of lives annually. Lung cancer is considered as a silent killer, so it is very important to watch out for some of these symptoms like persistent cough which has not settled for at least more than 3 weeks. If you are coughing up blood, if you are losing weight and appetite, if there is increasing breathlessness and symptoms like these, you should see an oncologist at a very early stage. Since there is no one way to prevent lung cancer, it is very important for you to quit smoking, avoid the other risk factors of lung cancer, maintain a healthy lifestyle, stay hydrated, a good physical exercise to reduce your lung cancer risk. So on this lung cancer day, we pledge to control the risk factors and decrease the lung cancer. Thank you.
The main vision of this day is to create an awareness among the community about this disease and help themselves to get a screening for the lung cancer. Why this day is so important? As per WHO data, the lung cancer is more prevalent in this country and more patients are dying of this disease. So create an awareness among the country about the lung cancer and help themselves to have a better outcome and results from this disease. Thank you.
You know, every year there are around 2.3 lakh people who are diagnosed with lung cancer, and 1.3 lakhs lose their lives because of lung cancer. Now, there are many causes of lung cancer, but the most important causes are smoking, and smoke. You smoking is called as an active smoking. People around you inhale the same smoke is called as the passive smoking, and the smoke which emanates from different industries, automobiles. These are the main causes of lung cancer. And it's not that you smoke today, you are going to develop lung cancer in the next 1 month or 2 months. You might be a smoker 15 to 20 years back, but still you stay at the risk of having lung cancer. So stay safe, say no to smoking, and let's all avoid lung cancer. Thank you.